Welcome to Angel's Watch. I streaming your health instructor and blessing. Today we shall be looking at another important health topic, Rhesus factor, and why it is important in marriage. Rhesus factor is an important component of the blood group system. After the ABO blood group system, the Rhesus factor system is another important blood group system that should be considered in marriages. This is because it can cause serious complications in children, which can put a strain on the marriage, particularly for couples who want to have their own biological children. What then is Rhesus factor? Rhesus factor is a certain type of protein found on the surface of your red blood cells. It is genetic in nature, that is, you inherit this protein, which means you get a Rhesus factor from your biological parents, emphatically the father. This protein on the surface of your red blood cell determines your blood type, and each blood type has a positive or negative factor. This positive or negative factor next to the blood type is a Rhesus factor. Everybody either has the Rhesus factor present or absent in their blood. If you have it, you are Rhesus factor positive. If absent, you are Rhesus factor negative. Majority of people, by 85%, are Rhesus factor positive. However, that does not mean that people who are Rhesus factor negative are sick or have disorders. It should be noted that the Rhesus factor system will not determine whether the couple will have a great marital relationship or not, but it can cause serious issues in childbirth and child nursing. The Rhesus factor becomes an issue when a woman is Rhesus factor negative and a spouse or husband is Rhesus factor positive. In such a case, there are chances they could give birth to a child with Rhesus factor positive, with either Rhesus factor positive or Rhesus factor negative. If a child is Rhesus factor negative, it will cause a problem because the mother and the child do not have the Rhesus factor antigen. But if the child inherits the antigen from the father and is Rhesus factor positive, this becomes a problem because red blood cells from the Rhesus factor positive baby can cross over to the mother's Rhesus factor negative bloodstream, triggering an immune system response because the mother's body recognizes that the Rhesus factor positive blood is not hers, and therefore sees it as a foreign object or threat that should be destroyed. As such, we try to destroy it by making anti-Rhesus factor antibodies to attack the Rhesus factor antigen from the baby. The antibodies form may also cross back to the baby's blood from the placenta, where they will destroy the baby red blood cells, and this can lead to the yellowing of the eyes and skin in babies, popularly known as jaundice. The effect of this on the baby can range from mild to severe. In a nutshell, Rhesus factor incompatibility often does not cause problems if the mother is Rhesus factor positive and the father is Rhesus factor negative. This is because when the mother is Rhesus factor positive, her system cannot make anti-Rhesus factor antibodies to attack the baby. Problems also do not arise if both the mother and the child are Rhesus factor negative. But when a mother is Rhesus factor negative and the baby is Rhesus factor positive, the mother's immune system forms antibodies to attack antigens on the baby red blood cells. Firstborn babies are often not affected unless the mother had an abortion or miscarriage earlier, which caused her immune system to develop antibodies against the Rhesus factor antigen. The next time she gets pregnant with a Rhesus factor positive baby, her antibodies will attack the baby's blood cells when they come in contact, and this usually happens during childbirth. Destruction of the baby's red blood cell can lead to hemolytic anemia, which occurs when red blood cells are destroyed faster than they can be replaced. Severe cases of hemolytic anemia can lead to liver failure, jaundice, and heart failure. Other complications caused by Rhesus factor incompatibility may include fluid buildup or swelling in babies, mental problems, brain damage caused by a high level of bilirubin accumulation, problems with hearing and movement. While babies are affected, mothers are usually not affected. And to avoid complications that may arise due to Rhesus factor incompatibility, Rhesus factor negative mothers should seek medical attention from their gynecologist when pregnant. Fortunately, A special injection known as Rhesus factor immunoglobulin injection or RUGAM is now used to treat this incompatibility issue. What then is RUGAM? RUGAM is a medicine that stops the mother's Rhesus factor negative blood type from making anti-Rhesus factor antibodies that attack her baby's Rhesus factor positive blood cells. It is usually given during the 28 weeks of pregnancy, that is the 7th month of pregnancy, and then again within 72 hours after delivery. This is to ensure that future pregnancies are safe. Aside from during pregnancy, women with Rhesus factor negative blood, they also need to get the RUGAM injection after an abortion, after a miscarriage, after they've had an injury on the abdomen during pregnancy, and after running some pregnancy tests such as a chronic villus biopsy. Remember, your health is a concern. Do not forget to subscribe to this channel for more interesting health topics.